All right, we are live. So, of course, we're always about a minute or so behind, just waiting on Cora. As you can tell, I don't have much of a voice. I got sick last week, which is why last week's podcast was um, a meditation instead of a live podcast because there was no way I was going to be able to do a podcast like this. So this week we should be able to have a pretty engaging, interesting one. I'm looking forward to getting everything started, which is kind of exciting. We're just going to wait on Cora to get here. And what we want to talk about today, oh, there you guys are. What we're going to talk about today is the effects of treatment when it comes to pain, and more specifically, our thoughts on causing pain during treatment and what that looks like. So that's what I am hoping for here. Just waiting on our Cora to get in. I'm gonna send her a nice little quick little reminder. Ugh. So yeah, if you have been in the industry for any length of time, or if you know anybody who's been in the healthcare industry, we usually have a pain scale that we talk about and we talk on, and we talk to our patients, our clients, about where they're sitting at the pain scale. And the pain scale is very much it's a subjective scale, if you would, right? On a scale of 1 to 10, and each person's scale of 1 to 10 is different than other people's scales. So my pain scale of 1 to 10, 10 being the worst pain I've ever felt, 1 being like it's kind of there. I notice it's there. It doesn't quite feel normal, but it's not really painful yet. Right? So my scale on that is going to be a lot different than somebody else's scale. I've never given birth, so I don't have the pain scale of what it's like to give birth, which would probably put my 10 way above where it is right now. Right? And I'm sure Cora will be able to tell you a little bit about her pain scale on that side. The most painful thing I can really think about ever having to endure, other than broken bones. I've had a couple of broken bones, but I had them when I was a kid, so I don't really remember that pain all that well. But as an adult, I've had some really, really, really bad cramps. It's probably going to be the highest form of pain for me. That might be like an 8 or 9, but the worst pain I've ever felt has been tooth pain. Absolutely the worst pain for me. So my 10 is actually based on my experience with tooth pain. I've had to get like teeth pulled and all that kind of fun stuff. I know it's not actually fun. I just say all that kind of fun stuff. There we go. So, and my dogs are barking. Come here, baby. You want to come say hello to everybody? Come up. Come up here. Come on. There we go. He's a puppy wanted to come and say hello. He's a pretty puppy. This is Loki. For anybody who doesn't know my dog yet, he is always in the background. 2 weeks ago, he ran into the screen. It was kind of hilarious. This week he's been a little, just a little on edge and spending a lot more time outside than he normally does, which is pretty crazy. But yeah, when it comes to pain and massage therapy, I am of a very particular mindset on what is, in my mind, considered therapeutic versus things that could be a little bit more dangerous to the body and painful to the body. I'm not a big fan of causing pain to relieve pain, right? So fighting fire with fire is a real thing, but it is not the only way to deal with fire. Same thing with pain and treating people who are in acute or chronic pain. Fighting fire with fire or fighting pain with pain is not something that I particularly do, nor do I particularly agree with some of the methodologies behind it. That's what we kind of want to have our chat about here. So yeah, if I were to create my own pain scale, and I'll have to reiterate this when Cora comes in, but if I were to create my own pain scale, it would go 1, like 0 to 1 is no pain to, yeah, I can feel that something's off, but it's not even really uncomfortable. It's like the mildest of mild discomfort. 2 to 3 would be moderate discomfort. So 2 and 3 would be like in that moderate discomfort where, yeah, I know something's really not quite right there. It doesn't hurt. It just feels kind of weird, kind of different. 4 to 5 then would be moderate discomfort. Moderate discomfort meaning like, oh yeah, definitely there's something not right there. It's verging on the edge of pain, right? So like moderate now into like more high discomfort, less, oh yeah, it's something weird, but I can deal with it, more like, oh, okay, now I feel it. I'm on the verge of pain. I'm apprehensive about pain, but I'm not yet in pain. That would be like 4, 5. Right? So 3, 4 moderate, 4, 5 would be like, okay, it's almost painful. And from there, you dip into your actual pain scale where you're consciously recognizing whatever this sensation is as pain. Right? So 6, 7 would be mild pain. 8, 9 would be moderate pain, and 10 would be severe pain or the worst pain you've ever felt. Right? So just sort of gradually going up that scale. As you gradually go up that scale, we get into the territories of where do we treat inside of that scale. And because everybody is so different, everybody has different scales of pain for themselves. Again, somebody else's 10 is not going to be my 10. How do we create a treatment protocol that is going to actually be helpful to our clients and not cause them any pain? And I'm very much looking forward to getting into that conversation. Oh, looks like she is on her way to us. That'll be fantastic. So yeah, I see a couple of you trickling in at the beginning here. Thank you so much. Welcome in. It's really nice to see you. So feel free. I've got the chat open on my phone so I can look over and see what you guys have said. Just know that it's going to be about 30 seconds or so, 30 seconds, maybe 45 seconds before we respond to anything because we are delayed through our video app. We are a little bit delayed. But yeah, if you feel free to comment what your thoughts are as we go through the discussion about pain and what pain is good, what pain is bad, the different characteristics of pain. Like we're gonna go through the gambit of it today. As soon as Cora gets here. So what I'm going to do while we're waiting for Cora to get here is I'm just going to throw on some music. And then I'm going to take a drink of water because, as you can probably hear, throat's not the greatest. And then when she gets here, we will get started on the full discussion. This is one of my songs. Makes me really happy. It's a good one to have as an interim. She's having some technical issues. I tell you, the water has been the best thing for me. If you're just joining us, we're just waiting on one more or my co-host, and we're going to get started in on pain. Thank you for coming in. Feel free to introduce yourselves if you want, or chat in the comments with me while we listen to music and wait. Guys, I'm my co-host. I've just come in. My co-host is experiencing some technical difficulties, so we're just giving her a couple minutes to get her stuff in there, and we'll get this started properly. There she is. There she is. All right, hi.
Sorry about being tardy. Technology is not my friend today.
Apparently, that's okay. It happens to all of us. It's so much fun. So, we can get this started properly. Welcome, one and all, to Just Massage Therapist podcast, where two massage therapists talk about, well, whatever we want to talk about, really. Knowing that at the end of the day, it's just our opinions. We're just massage therapists. And we just like to chat, especially with each other. Oh my God. We definitely like to chat with each other a lot.
That we do.
So did it just not come up in the right email address?
It was just saying, it was just my password. It was wrong. And I kept putting in my password and I was like, it's wrong. It's wrong. It's wrong. And then finally you sent me that second link. And then I got in and then my password worked.
That's so funny.
Yeah. Fun.
Kind of hilarious.
That's okay.
Oh, totally fun. I love technology for that kind of stuff. So before you came in, we were just listening to a little bit of music, but before that, I was just doing a bit of a talking about pain and how pain for everybody is a little bit different, but we all use a general 1 to 10 scale.
Yeah.
Right. And that my 10 would be different than, say, your 10. Right. I likened my 10 because I said I've never given birth. So my 10 is definitely going to be a lot lower than a lot of other people's 10. The worst pain I've ever felt is actually my teeth. Right. Tooth pain. That's the worst pain I've ever felt. And honestly, I can't even imagine what the worst pain would be if I had ever given birth.
Well, I feel like that tooth pain is a lot more constant than birthing. So it's going to eventually make its way higher on that scale just because it's constant.
Yeah, it is a constant. That's true.
Yeah.
But for the worst pain I've ever felt thing, yeah. So my pain tolerance in that 10 is still a lot lower than most people's in my estimation. Um, the other thing that I wanted to, or that I noted before, and I want to note again, was what I see as the pain scale. Right, 0 to 1 being mild discomfort, 2 3 being moderate discomfort, 4 5 being like true discomfort, edging on pain. Right, like the apprehension of pain, but not quite pain yet. And then 6 7 being mild pain, 7 8 being moderate pain, 9 10 being like severe pain and worst pain I've ever felt. How do you feel about that scale?
Yeah, I pretty much mirror that too. Except I would say that 5 6, that would kind of, or that 5 would be, it's kind of the middle of the scale for me. So I feel like that's kind of where that threshold starts to cross.
Yeah. So you'd go like 4 being the discomfort edging on pain, and then 5 being where it tips over into pain.
Well, yeah, pretty much. And then 5 would be that very mild. And then as we move up the scale, 10 would be like, I can't even breathe. It hurts so bad.
Yeah. Oh my God.
Yeah.
I can't even breathe. It hurts so bad. I remember that. My God. Honestly, that was the worst. Both sides, man. At the
I
same
can't
time.
even. I can't even imagine that. Like I can handle a lot of things, but anything in my head, I can't do it. Like
Yeah.
I can have, like I can be really sore, I can be achy, but as soon as I get a little bit congested, man cold incoming. Like actually, it's a thing. And I would rather just like lay on the couch and nurse my sinuses, but I can be coughing up a lung and I can still go and do my job. I can still
Wow.
go out and about, coughing like crazy, but as soon as I get congested or headachy, I'm down.
So if it's like
Like
here up, you're done.
pretty much. Yeah.
Oh, yeah.
It affects my brain. I can't function.
You know, it's really funny. I don't get headaches, right? Like every once in a while, I'll get a headache. I've had, I think, 2, maybe 3 migraines in my life.
Hmm.
All right. My sinuses are usually extremely clear, but my ears,
Oh, okay.
will go. I've been very fortunate this round of sickness that my ears have not gone. That it's all stayed right here.
Yeah. That's
Yeah.
yeah, that's I can't say I've actually really had issues in my ears that I can recall, but I feel like that would affect me very similar to my sinuses.
Yeah,
One of my
it's really bad. Yeah.
yeah,
I used to get them. I used to get ear infections all the time when I was young, to the point where like the highest level antibiotics weren't even working anymore.
really, hey?
Yeah. I'm
Oh,
very grateful I grew out of most of that. So I don't get ear infections half as bad anymore, but man, they were bad.
yeah, that would be oh, yeah, I can't even like I had migraines for maybe like a week of my pregnancy with Jacob and pretty much the whole pregnancy with Cassidy constantly.
Ugh.
But that was the only time I ever really had them, but they would knock me out. Like I used to have to wear my sunglasses during the day all the time. As soon as
I remember
I was,
that.
yeah, all the time. A smell came by. Oh, I got a headache. I got to put my sunglasses on. It's a thing, especially with
Yeah.
Cassidy.
I remember it specifically during Cassie. I didn't remember it during Jacob. For some reason, I don't remember the sunglasses coming out at all. But I remember you pregnant with Cassidy. Oh my God.
That's how I
You
knew
were
she
like,
was a girl.
oh. That's funny. But that isn't why we are here today. We're here today because we want to talk about pain and treatment as massage therapists, and what our views are on causing pain during our treatments. So I'm going to rest my voice a little bit. So I want to know what your thoughts are and how far you tend to go with your treatments, what your treatments are like, and what your thoughts are on the debate of, do we cause pain to end pain, or is that just not good for the body? What do you think?
Well, I personally don't, I'm not a pain for gain therapist. I hear that pain for gain mentality. It actually makes my neck tense because I just think it's so like counterproductive because we're trying to help the structure. We're trying to get the structure to relax. But if we're actually going so deep or aggravating it enough to actually cross that threshold into pain, then the body's going to do what it's going to do and protect itself. Oh, sorry, one moment here.
Oh, do we have a little one that needs some? We have a little one that needs some assistance. So I'm going to actually just sort of piggyback off of what Cora said there. So any of you that are watching this or watching this later, if you are or are not massage therapists, there's one thing about our bodies, especially our muscles, that we do need to have a bit of an understanding with before we start jumping into the pain and gain conversation. So every single one of our muscles and a good number, if not all of our ligaments, have these very particular sensory fibers inside of it. And they're little sensory nerves. They pick up on certain things. In our muscles specifically, we have one that is called a muscle spindle. We also have another one that's called a Golgi tendon organ. And then in our ligaments, we have something that's very similar to that Golgi tendon organ. And then all of these structures have pain sensors as well. So they're picking up pain sensation in those deep regions, just as well as they're picking up other things. Now, what we as massage therapists and other healthcare practitioners are aware of is that if we go too hard with contracting a muscle or overstretching a muscle, overstretching a ligament, or pushing too far in and causing pain, going over a pain threshold, the body will start what is known as a reflex. And there's three different kinds of reflexes here. If it's because of over contraction of the muscle, it's going to cause a reflex that causes the muscle to relax. If it's because the muscle is overstretched, so the belly of that muscle, the inside of that muscle gets really, really overstretched for some reason, it's going to cause that muscle to contract. And if there is pain involved, it's also going to cause the muscle to contract. Right? So we have to have an understanding of that, just a basic, easy understanding that our muscles respond usually by contracting, sometimes by relaxing, but most of the time by contracting and going into what we call a spasm. Now, most of the time it's muscle guarding, and muscle guarding is good, it's protection. And what it can turn into, if it isn't resolved, is what we call an intrinsic muscle spasm. Now, intrinsic muscle spasms, they last past the 2 days after an injury, and they are not good. They're no longer really protecting an area. Now, that's not every time. There are certain times, like when you dislocate something or break something, like break a bone, you want to keep that muscle guarding for a longer period of time. But generally speaking, after the acute period, which is about 2 to 3 days, muscle guarding should go away. So, Cora, now that you're back, now that people have that information, do you want to talk or continue talking about your idea on the causing pain for gain thing?
Yeah. So, yeah, I just feel like it's very counterproductive, just again, because we are going to be causing the muscle to protect itself or attempt to protect itself. And in doing so, it's going to increase tension, which over time, if we continue to aggravate that, we could cause injury. And not only that, but once we bring past that threshold, the client's no longer able to diaphragmatically breathe. We can tell them, oh, breathe with your diaphragm, breathe with your diaphragm, breathe through the pain, breathe through the pain. But with pain, there's that shallow breathing, you have that apical breathing with your chest. So you're not actually stimulating the PNS anymore. And it is completely counterproductive, in my opinion. Now, that doesn't mean that massage is all puppies and unicorns either. Like there are going to be like painful areas or areas of discomfort, but that's where it's really important that we disperse that with soothing techniques coming in and always coming back to that problematic area, that painful area, so that we can kind of desensitize it, slowly work through those layers so that we can really address even the connective tissues. With my
So
myofascial background, oh, sorry.
just before you get going, when you said PNS, what are you talking about?
Oh, sorry, the parasympathetic nervous system. That's our rest and digest.
Okay.
So we're kind of coming in. That's the state that our body's in when we are relaxed and calm.
Which neither one of us are like that right now. We're both kind of like, oh.
Coffee!
So you were going to go about your myofascial.
Yeah. So with like my myofascial background, I tend to address those really painful areas very much by addressing those layers, those connective tissue layers. So I'll always start off with the myofascial stretch and start breaking up some of those cross links. And then based on what the restrictions in the connective tissues, and then based on how my client feels about the myofascial release, I'll usually go as long as I can with it. Just for, especially once the body starts to receive me, and then the release happens on a deeper level. But after the fascia is nice and warmed up and released, then I will come in and I'll start to actually get the Swedish techniques going, and I'll work more specific that way. And that's honestly the best way I've found to address it.
So when you're working with the fascial layers, are you talking about starting like skin deep fascia and then going into layers after that? Like, do you do skin deep and then top fascial layer of muscle and then fascia and then muscle and fascia, or you go fascia, and then go back in muscle?
It's usually fascia, and then the muscle gets incorporated in that too, right? Because
of course,
fascia surrounds the cells. So as we're working on it, it's kind of one of those where it's very much finding that tissue barrier. So like we can find our own tissue barrier. Like even if you were to take your hand and put it on your arm and just close your eyes and sink into it, like that very first barrier, that first level of resistance, that's where I would start. And then as it starts to release, the body receives me, and it's kind of like oobleck, where you come in, you can come in fast, and it's, or cornstarch in water.
Have you ever played with it? Like what is oobleck? I remember now. Oh my God. Yeah. Cornstarch in water.
Yeah. And you can come in really hard, really fast, and it'll be solid, like water, even if you come in really fast on a flat surface, come in really hard and fast. But if you allow that to soften around you and you kind of cut through the molecules, or then all of a sudden it's received. And then that's when the real releases start to happen, actually.
Yeah. It's fun that you say that. I love that you bring up molecules, because I just did a tutoring session that was specifically on bonding, like covalent and ionic and hydrogen bonds. It was so much fun. And then like acids and bases, right? So of course, my brain has been in that zone for a couple of days now. One of the beautiful things that I've noticed about fascia and any of the connective tissue that we work with is you can always tell when you've got fascia that's willing and ready versus stuff that's a lot more stuck or closer to scar tissue because of that resistance, right? Those resistances, like you can even just tell on me right now. Okay, so this beautiful guy right here, he's stuck. Like, look at that. There is so much resistance just in my biceps region. It's absolutely crazy. But if you come to my forearm, right? Look at how much movement there is. Look at that. You can always tell this stuff is always so ready because I'm constantly working on it. It's always so ready to give in and give up and allow for the water that's like the interstitial fluid that's supposed to go between all the fibers and cells. It's so ready to increase that water in there and allow for movement. But up here, because I barely ever work on my upper arms, it's like you can't move any of it. It gets so stuck and it feels like it's almost scar tissue.
Yeah, I feel that. my neck up here, the base. Yeah. Because of my scoliosis, my C1 pops out all the time. So it's like, even when I go to the chiropractor, it's in a line for maybe 3 days, and then I move wrong, and then all of a sudden it's like, oh, I'm subluxed again. And that's when I get my headaches, actually, is when C1 sublux. And then I have that headache until my body adapts. And then I'm used to it because I'm back to my normal.
Yeah. Normal.
What my body perceives
so
as
funny.
normal.
Yeah. I get it. Have they classified that as a serogenic headache for you then?
I've never actually went to the doctor for it. It's just kind of one of those things I just deal with.
Well, I mean, you go to the doctor or chiropractor for it, but
yeah. The chiropractor has. I've actually never really mentioned it to the chiropractor. I usually just use my craniocradles or my still point inducers, and based with those still point inducers, they're miracle workers. Like, honestly, if you guys want to look into still point inducers, I strongly suggest them. They are amazing. You can release your whole dural tube with the still point inducers if you get two.
At some point, if we can remember to look up where to purchase them, I can put a link in the description when I re-upload this later.
Sure thing.
That'd be good.
Yeah, they're amazing. I love them. I swear by them. I got introduced to them in my myofascial courses, and I love them since.
Yeah. I feel like you have someone who needs your attention again for a moment. That's okay. I've got a couple of things I want to say anyway. So outside of working the layers, so Cora and I are very muchly on the same page here when it comes to pain for gain. Neither of us really subscribe to the need to cause pain in order to relieve the things that are going on. Now, there are a number of different viewpoints on this and different like levels of pain that people are comfortable with going. Now, in school, we're usually taught that it's okay to go up to about a level 7 pain, which is getting into that moderate where it does feel actually painful, that moderate pain. So that is generally the highest most massage therapists will ever go. Although I have definitely known some massage therapists who believe in going a lot further than that, like doing things like grass stand technique, Bowen therapy. Those things are going to definitely be more pain as they do the scraping, right? People who do rapid therapy, rapid is a very painful technique at times. So there is something to be said for certain types of painful techniques, although I myself will not take those because I don't believe in causing pain to my clients to help get them out of pain. I don't believe in fighting fire with fire in the body because I have that really big desire, or I guess aversion, not desire. I have a big aversion to causing painful spasmodic reflexes in the body. So all of my training has been towards layers, going down through the different layers of muscle from the most superficial you can all the way down into the deepest that you can get into without causing pain. Does it take me longer to get to certain structures? Yes. Do I get to them without my clients being sore for 3 days after or a week after? Also, yes. Means that I do more treatments, shorter sometimes even treatments, and it takes us time to allow the body to heal itself instead of just trying to get in there and risking causing an even bigger adverse reaction.
See, I like that you kind of mentioned rapid because I use it sometimes. It's not my go-to, but that was actually something that was kind of the missing link in my fascial training too, because it was very everything. Oh my goodness, I'm sorry.
No, it's okay. For those of you who have not been to one of our episodes before, one of our podcasts, we are very big on family. Kind of means everything. So no matter what we're doing, family is always going to be someone involved. So you're going to hear them in the background. And sometimes we need to deal with them. Kids are the most important thing, and we have to be really conscientious of them in our podcasts. So she was saying that adding in fascial, there are some pertinent parts of the rapid techniques that I really think are pretty cool and really neat. And I am sure that there's times where fighting fire with fire is actually necessary, but I don't agree with it as something that you do all the time. Same with Graston, same with Bowen. I don't agree with causing pain consistently in order to relieve pain. Now,
Yeah,
that's
that's
not to say that it doesn't work, because some people believe that that's the only way they're going to get relief. And because they believe it's the only way they're going to get relief, that's how they get their relief. Right? Those people generally don't come to me. I won't go above a 5 on a pain scale. I refuse to go above a 5 on a pain scale.
yeah, I'm around that 5-6, kind of flirting with that a little bit, but with the rapid, sometimes, like especially when we're dealing with really chronic injuries, I know, like in my fascial training with John Barnes, he would say, like, something he would always say was, when something is holding on tight, sometimes you have to shock the system. You have to shock it enough so that the body can release it. Kind of like that, oh, you scared me, oh, now I can laugh kind of situation.
Okay.
Okay, so I find that with those really stubborn muscles or those really chronic injuries that have been around for a really long time, sometimes those structures have to be shocked. And that's kind of when I come into the rapid, because the body's so used to being in its position and it's so happy there. I always say we're like a 2-year-old, like what's familiar, what's easy, what's safe, and we don't like change. And sometimes change comes at us fast and it's chaotic, but it's effective. Both of us can relate to that. And with and with rapid, it is that fast, sudden shock. And then all of a sudden the body's like, okay, I'm ready to reset. And because rapid also does come to the periosteum of the bone, like right where the muscle attachment site is, that is the optimal fascial connection point to address the muscle. So it is very effective. I don't say that I will do a full treatment with rapid, but I do definitely incorporate it where I feel like I need it.
That's really cool. It's really nice to hear that. I always love listening to other people's point of views on this one. I find that if I'm going to do painful techniques, which every once in a while I will do, right? Fighting fire with fire, sometimes you have to. It'll only be when it comes to scar tissue.
Okay.
Because scar tissue doesn't have the same neural involvement as muscle, tendon, ligaments. Scar tissue doesn't have neural involvement. I mean, a little bit, but it doesn't have the same amount of C fibers, the C pain fibers, which are those deep, chronic, achy pains. It doesn't have those same ones in there unless it is riddled with adipose and fatty tissue. Right? Most of the time, scar tissue is just stuck collagen, and the reason it hurts the area is because it's pulling on the muscle or the other structures around it and causing their pain receptors to go off. So yeah, I mean, that's, in my mind, that is where painful techniques belong. Now, I'm not saying that I'm not fluid in my thinking, right? And there's a lot of teachings that I haven't gone through yet. I haven't gone through all of the rapid stuff, right? So yeah, there might be something there that could help me understand doing a little bit more painful techniques. But it's just, yeah, it's not my cup of tea.
Well, what I found really funny actually is, I just found it really interesting. Like when I was in rapid, when my rapid training, I think it was upper body, but they were saying how they were talking about the emotional connections and the psychological connections with pain. And they told this story about how this gentleman, he loved walking and he was an avid hiker and he was somewhere where there was no poisonous anything. But where he went to hike, there were poisonous snakes. And he was walking and he felt something snap against his ankle and his brain told him it was a twig. So it was a twig and he just walked it off. He woke up in the ER. And then he survived, and then he came back to the same location, and he was walking again. He felt something against his ankle. He was in the worst pain of his life. He was gonna die, and it was a stick. And at first I was like, okay, that's a funny story, okay, but then I actually met somebody who met the guy, and I was like, oh, maybe it's not just a story.
It's not just a funny story. But yeah, how we experience
story.
pain is always so different.
Mm-hmm.
My goodness. Yeah. I wonder what it would have been like if it had been the opposite, right? If the first time had been the twig and the second time had been the stake. The second time he probably would have walked it off just like the twig, because that experiential connection wouldn't have been there.
Yep.
That is the other thing about doing pain techniques that is always so interesting to me, or doing any sort of release technique, because I won't go past the 5. I generally speaking, the releases that I get to experience with my clients, they're slow in the moment, but they're massive by the end of a treatment, because I never over-treat an area. And the releases that they get, both physically, but then also emotionally, they just, in my mind, they seem more rewarding and more sustainable. Because I don't like the idea of having my clients, my patients, respond to a super painful treatment with a massive emotional release, and now that's what they think they need to get that release.
Yeah.
I don't want them getting dependent on massively painful treatments for release. Not that I'm saying that they would all get dependent, but I don't want that to be a possibility, because you can actually get dependent on something that gives you relief.
Oh, for sure. Mm-hmm. It's a thing.
It is a thing.
Yeah.
We have to think about it as massage therapists all the time, making sure that our clients are not getting dependent on us to fix them, that they see that we're there to help their body fix itself, and that they have things they can do as well to help fix their body.
Yeah, that's my favorite part. I love facilitating that healing journey and just being part of it and giving them the tools. And it's amazing when they actually take the tools. And then I can tell them, you know what? We're on to maintenance now. Because we're only on to maintenance if they want to be. That's yep. They are in charge. We're just we're there to give them the tools. But at the end of the day, it's all on them.
Yep.
And that's something that they don't really understand either.
I find that a lot with first-time massage clients, or people who have been going to see maybe some therapists who don't put that out there as much, who do create a reliance on them. Right? I much prefer being able to take them to maintenance, and at maintenance be like, okay, do you want to do anything more than what you do in your activities of daily living? Like, do you want to increase now? Because we can increase now. Here's things we can do. Instead of just getting them to ADLs, what we call activities of daily living and maintenance, at that point, we actually get to be proactive with you.
Yeah, it's so fun. It's also awesome. I just love it.
Yeah, me too. Any massage therapists who are watching this, you know what this is like. It's like, oh my God, yeah. Once we get them back to this point and we get to see them once a month, we get to start seeing them literally get better than just their baseline, their base normal.
And we see personality improvements too. Like there's some clients, they come in and they're just so grumpy and it's just like, I don't know if I want to I don't know if your energy field is like keeping me way over here. Am I allowed to touch you?
Yeah.
You know, and then after they're not in pain anymore, all of a sudden it's just different. And then all of a sudden they go from grumping all the time and having nothing nice to say to actually smiling. And that is the best thing ever. I love that.
I do love that.
Actually, it's so good.
Well, I mean, pain makes you do and be a certain way. When my teeth were going, both freaking sides, both sides going, and I couldn't get them fixed at the same time. They did one side and then they did the other side. I was the grumpiest I think I've ever been in my life. Because you're just constantly having to fight this numbing pain. Nobody wants to deal with that forever. Right?
Nope.
Now, there are going to be certain people that we deal with that they're going to be in a constant state of fighting pain. People with fibromyalgia and chronic fatigue syndrome, people who have central nervous system disorders and things like muscular dystrophy. There's going to be pain on a constant basis that they're going to have to come back regularly just to try and deal with that. Right? Now, that's not the majority of our clients, but it's not the majority of the people who are going to listen to this. But yeah, it is something that we do have to keep in mind. And again, with that, never going past a 5. Like for them, actually, I never go past a 4.
Yeah.
Ever.
With fibro. Yeah. No, I won't. Yeah. It's very, I'll throw with the discomfort, but
Yeah.
I won't take them far into that discomfort just because it's so unpredictable too, right? Like, but then again, they know their body, so it's important that we listen to them and what works for them, because the textbook is one thing, but real life is another in lots of
Completely different.
situations. So it's what kind of listening, but then you always got to watch for that too, because sometimes it just feels really good in the time, and then they pay for it for like days or weeks later.
Yeah. Although I will say that I have had fibromyalgia clients, or I've had friends who've had fibromyalgia clients, and they're like, I don't care. Go as deep as you would normally go with anybody. Take me up to that 7. I'll deal with the 2 days of pain afterwards because it'll feel like every other day. And then I'll have a week where I don't hurt.
Then there's that.
Right. So there are some clients who are like that as well. But even with them, I have not gone above a 5, because for them, a 5 is their absolute baseline. That's their normal. They're always at least at a 5. Yeah. Oh my gosh. So much fun. Oh, I've had some really fantastic clients on that side. Mainly because I like to deal with the big chronic conditions. I like to deal with things that there's something deep-seated that could affect not just their physical body, but their psyche, their mentality, and then as well their autonomics. Their autonomic nervous system, how their heart's working, how their gut's working, how their sweat glands are working. Because every time you do something that causes pain, you are going to cause a change indirectly to every system of the body. Every single system, including sweat glands. Every time you start the sympathetic division, which is our fight or flight, every time you start that, it affects everything head to toe. It literally, it doesn't cascade the way that the parasympathetic does, right? It cascades like a little water fountain. No, our sympathetic nervous system happens all at once, all together. Within milliseconds, it is responding, and it is lasting forever, because we're now talking about hormones getting sent out. So every time you cause pain, you cause a fight or flight response, and you're releasing norepinephrine, epinephrine, and cortisol. And that's where the typical breathing comes from. Right? Every time you cause pain, they're going to breathe up with their chest and not with their diaphragm, because that's what norepinephrine and epinephrine is going to make you do. It's opening up here, because you need to get that breath in. Oh my God, we're in pain. We need oxygen because we might need to fight something or run away. In my mind, there is no place for that, or at least there is only a very tiny, small place for that in a treatment space.
Yeah, I very much agree with that.
Yeah.
Yeah.
How long is it?
I did.
No, go ahead.
Sorry?
No, go ahead.
It's okay.
How long is it after you first make contact? I always forget. How many seconds is it that the body immediately goes into fight or flight?
Oh, 30.
I always forget. 30 seconds.
Yeah.
Thank you. I always think 15, and I'm like, no, 15's wrong. 30 seconds.
The body loves 3s.
The body does love 3s, doesn't it?
Body loves 3s.
Oh my gosh.
The first 30 seconds of touch, the body doesn't know if it's good touch or bad touch.
Yeah.
And that's one of the reasons why we shouldn't break contact too often.
Yeah, that's the other thing. So there's a lot of therapists that I've seen in my time who will do a technique and then they will push the energy off while they're treating, right? Which I'm not, I love energy techniques. Don't get me wrong. I think they're freaking amazing, but I think that they also have their time and their place. Because a massage therapist or a manual therapist who puts their hands on a client needs to be able to maintain that contact and not reset the body into fight or flight every time they remove their hands. So for 30, every time you put your hands on, 30 seconds, thank you for the timeline because I always forget. For 30 seconds, underneath where your hand is, the blood vessels are going, is this good or is this bad? And then it'll relax. But the initial response is vasoconstriction and to start your sympathetic nervous, your sympathetic nervous system, your fight or flight.
I wonder with that, I wonder if that's why a lot of like the Western energy medicine more hovers and there's no contact.
I think that is probably the best form of energy medicine because you don't need contact to move energy. I mean, sometimes you do. I shouldn't say that you don't need it, right? You do. But for the techniques where you're trying to release and remove, having to constantly touch and untouch, touch and untouch, it's sending the body's nervous system into spirals constantly.
Well, see, the energy where like the Reiki that I was taught in was Jedikin Reiki, and it is contact. So, and it's not, there's a little bit of brushing, but not really. It's more like myofascial, actually. Like you're coming in, you're laying your hands and you're feeling for the different sensations, the different pulses, the different heat waves that are coming underneath your hands. Mm-hmm. And that was, and that one makes way more sense to me. Like, I honestly don't know that I'd actually be able to hover. I think my mind would go too crazy if I didn't have my hand in contact.
Well, here's the thing. It's a different sensation for you with the hover versus the touch, right? You would actually be able to feel it's just a different sensitivity that you develop.
Fair enough. Yeah.
Right? So the sensitivity of hover versus touch, right, is very, very different, even though it's still working on the same energies.
Yeah.
Yeah. It's kind of cool.
Yeah. I guess because I'm very tactile.
You are very tactile.
Like, and I can't see it. And if I can't see it, I have a hard time understanding. Yeah. But I can feel it when my hands are in contact. So, yeah. Does that make sense?
It does. Yeah. I would challenge you one of these times to take a Reiki course that is only hover and see how much you can develop the sensitivity to that, to the change in energy versus the change of energy that you can feel physically like this, because you'll still feel it physically like this. You can't help it. It's just a different sensitivity to try. So there we go. You got a challenge. Yeah. I guess I'll have to challenge myself to give Rapid a little bit more of my thoughts.
Well, it's one of those, like, I don't know. I guess, like I said, it's not something that I would do with everybody. And I use it when I have to. It's one of those tools that I pull out, like frictions. It's a tool that I pull out when it's necessary. Yeah. I won't, like, if somebody books in for Rapid, I'm not going to give them a full hour of Rapid. For one, their body can't handle it.
My God, no. My body could not handle that.
It's too much. No. Like, I know a lot of the Rapid therapists that I do know, they'll do like 15-minute sessions and they'll do 15 minutes of straight Rapid, which the clients enjoy, but my thumbs would not be able to handle that.
Yeah. Almost need to get some instrument assisted there. I know I would want the instrument, but then you can't sense it as well. Yeah.
Right. So, like, and even though some of the techniques that you use to get into Rapid, like if you're going into areas, like they teach you how to get into like endangerment sites and treat this, like those deeper structures within the joints. Yeah. So, and they're necessary because it's those little guys that cause all the problems because they're the bosses calling into work. So they're important to get addressed, and they're not necessarily, they're hard to address with just regular Swedish massage or even myofascial. It's hard to get there specifically. So to have that extra tool under your belt where you can actually target it and get very specific.
Yeah. Although you can do that with more than just rapid.
Also a really good tool.
I mean, I know that rapid's
sure.
very specialized in that, but yeah, even like with some of the specializations I have, getting into those, and again, not causing pain is possible. It just takes time. That's the biggest problem, right? Is if you don't want to cause pain, it's going to take you time to be able to relieve pain for certain structures and at certain times, not all the time, obviously. Right? Even with not causing, without going past that 5, I've been able to relieve a lot of trouble and a lot of pain and a lot of chronic issues in people in a session or 2. There are going to be times with more chronic issues where it's definitely going to take a lot longer to get through. Yeah. My voice is almost completely gone. So I think I may need to end soon. Is there anything that you want to add to the discussion today before we close off?
No, I'm good.
All right. Well, thank you, Cora, again for coming and joining. Thank you, everybody who came and watched, and those of you who are watching this after the fact, after the live. Let us know what you guys think in the comment section. And I guess we will see you guys in a week's time.
See you in a week.